Well, Duncan Hospital's a remarkable place. It's a wee Scottish oasis amongst the poverty and hardship on the border between Nepal and northern India. I really heard about Duncan as a child. I got to hear vague stories from the Duncan through friends of our family. My mother had graduated as a doctor, and two of her friends or classmates had decided to go overseas, essentially in a missionary capacity, and they were allocated to this Duncan Hospital. And they actually looked after a massive community which we were entirely unaware of. But about 5 million southern Nepalese without health care and 6 million from Northern Bihar. So twice Scotland's population being managed by this little Duncan Hospital set up by a GP from Edinburgh.
The first time I visited Duncan was in 2011. What struck me particularly was the maternity unit, very young mothers with babies, and the work that the nurses were doing. But it was the care and the warmth that really struck me.
They say that once you get to the Duncan, you can leave the Duncan, but the Duncan never leaves you. And we would tend to get subscribed to that.
It was an experience that changed us all, so I think we all came back determined that we had to share with people how much this had affected us and how important it was that we mobilised interest back here. We now have a special care baby unit that they couldn't provide before, and this means simple things such as phototherapy, where children would have died of jaundice. These children can be treated within the phototherapy unit in these intensive care facilities, and the staff have now been trained up appropriately to support these facilities. So we've another level of care, especially for young mothers and children. And on the horizon, we would like to redevelop the nursing school. Now, this is a particular challenge, but the Duncan Hospital survives on the fact that they provide training for nurses that are then resident within the hospital and then spend the first number of years attached to the hospital and then have the opportunity to go elsewhere. But the beauty of the InternalBrace is we've been able to use the royalties as this has become successfully spread out through almost 30 countries to help to support this initiative. So it's given us an opportunity that we wouldn't have had otherwise to support these people and some of their activities on the ground. So they're steering us in explaining where the focus of that care should be. Every penny that is donated goes straight to the hospital, and because we have visited the hospital regularly, we know exactly what's required.
There's always a sense that what's the point, and it's a drop in the ocean. But I have to say from our own experiences that these individuals are individuals. These children are children, and the differences in terms of their lifespan or their ability to just save a young mother at 14 from probable death and loss of a child, they can contribute to that. And I know there's so many other charities in demand of their time, but if they see some value in that, then the Duncan charity is something that can ensure that their contribution will have a direct and tangible effect on someone's life.